This is a breaking news update from Channel 3 Eyewitness News.
Good afternoon, I'm Cindy Sexton.
And I'm David Carroll. Breaking news this afternoon, of course, coronavirus, our top story. In just moments, Mayor Jim Coppinger of Hamilton County will speak about coronavirus.
And as soon as they begin, we will listen in, and there he is at the podium. They are starting in about 30 seconds. About an hour ago, the Tennessee Department of Health announced the number of COVID cases at 19, and that number has doubled in the last 24 hours.
Is that we want to be able to dispel a lot of misinformation that's being disseminated throughout the community regarding the COVID-19 virus. Thus far, we have no reports, and I emphasize no reports, of the virus being in Hamilton County. However, we are very realistic, and we understand that there's a high probability that's eventually we will probably have a case of the virus here. I think it's important that we have this press conference to express to the public exactly what's going on, to be as open as transparent as we possibly can due to the large call volumes we're having in the office, as well as emails and a number of other ways that people are transmitting to us. Is some of the concerns and what they want to hear from some of the experts you're going to hear from today. I will say this, I'm really proud of the coordination of the efforts that we've had. The 3 hospitals led by our health department have been meeting continually and will continue to meet in preparation, making different preparations for different scenarios. And again, I really applaud the efforts. I've been involved in some of those meetings. There's been a coordinated effort with our school system. They've made a recent announcement that I'm sure you've probably heard about, and we do have a representative here from the school system that will talk with you about that. But again, you know, wanting the public to know that there is this coordinated effort that's going on and will continue to go on in preparation for a number of different scenarios, which do include our own employees and being able to sustain government to run regardless of what the situation is. So we have all of our administrators that are here with us today that have helped to put together a plan for county government as well, so that in the event that we are stricken at whatever level that we may be, that we're able to have the essential services continue to be provided throughout all of Hamilton County. Certainly, there's a number of precautionary measures that have been taken. For example, you've just recently heard, and you'll hear more about the school system. Dr. Edwards-Town is here with us today. She can discuss that with you. But basically, what they're doing is closing school for a couple of weeks to kind of hit the pause button to see where we're going to be. But again, there are a number of things that are under consideration, and as we continue to meet, and if the situation escalates whatsoever, we feel like we have a plan in place, working with our hospitals, working with the Department of Education, one of our larger employers, and also being able to work with our emergency management, and that staff is here with you as well. All of this is done in a cooperative effort. As you see, we got a number of Hamilton County Board of Commissioners here today that have already stated that they're willing to step up, do whatever it takes, whether it's a financial or staffing issues, to ensure the safety of the people in this county. So I really applaud the hard work of our commission as well, as they've been engaged with this for several weeks now, and appreciate them being here with us today. We also have representatives here. There's been news that's developed about some of what's going on in criminal court and sessions court. We have Judge Tom Greenholtz with us here today, as well as Sean Johnson, who is basically the liaison between all of the courts, but here today he would represent the sessions court. I want to emphasize too the importance of what we're hearing from hospitals. There are people, the hospitals are the safest place to be, right? But for whatever reason, people that need some major medical attention, such as chemotherapy or dialysis or what, should continue to seek that care. And you'll probably hear from the hospitals, from Ray Bond here, in just a minute, but that's a concern of ours as well. The community needs to continue to carry on as what their medical needs are, but that is some concern. I also want to say that our emergency management officials have met today and will continue to meet with the businesses, both small and large, as has our health department, in coordinating with the Chamber of Commerce, as well as some of the other businesses individually, in an effort to look at the plans of how they too can address some of the emergency needs as they come out. One of the things, obviously, that's a concern, particularly with our school system taking the measures they do, is, for example, our large businesses we have over 44,000 students that are in our school system, is daycare, issues for parents. So we're looking at plans, and I know every business, and this is what our emergency management, our health department, and even what we're looking at in county government is how are we going to address this with just the people that need to be, essentially need to be at their office or at their respective positions. Examples of that would be, the Sheriff's Department, we need law enforcement, we all agree on that. Our EMS people, our people that are running ambulance services, our health department, obviously, are essential employees, particularly in this outbreak, as well as people like our emergency management. What we're looking at, and we've worked with our IT system, is to be able to have dial-up or teleconferencing or whatever to try to minimize in the future any contact where we have large gatherings or or so forth that aren't necessary, that could be done by telephone or by teleconferencing. So there's a number of things that we've put into place in county government, a number of things that I know businesses are putting into place. You're going to hear some more recommendations from the health department, but going forward, I just want to make certain, and the purpose of this media conference, and I had said before that we would only have this conference in the event that we had a positive. We clearly do not have a positive confirmation on anyone with the COVID-19 virus. I want to make that perfectly clear. I get calls constantly of people saying, I hear such and such hospital has, that's not the case. But as I said, I want to be 100% honest with the public to say that we suspect probably in the future that won't be the case. There will probably be, in all likelihood, a case here in Hamilton County. At that time, we will call you back together and give you as much detail as we can. That information comes to us through the Tennessee Department of Health, which is in constant contact with our local health department on a daily basis, and even more so, sometimes several times a day. So I just want to make sure that the message that we get out to the public is, at this point in time, there are no COVID-19 viruses in Hamilton County. Now with that, and I'll come back around, we'll take questions at the end. There's several people I want to introduce that's got a lot of input into this that I think you would like to hear from. And I'm going to start with our Administrator of Public Health, Becky Barnes. Becky?
Thank you. First of all, I want to say to all of our citizens that the health and well-being is your primary concern for us. We do not, again, have any positive COVID-19 tests in Hamilton County, but as I've said, we do anticipate that we will. We've been anticipating COVID-19 to reach our community, and we have been preparing and are still and continuing to prepare for this. We have been working with county EMA, emergency response partners, hospitals, private physicians, nursing homes, homeless service providers, schools, daycares, businesses, faith-based organizations, restaurants, and certainly internal Hamilton County government. Working together and individually, we can lessen the effects of COVID-19 in our community. I want to say that again. The health of our community is in our hands. People ask me frequently, what should I do? What are the most important things that I should do? It is every single individual's compliance with these simple things that will determine how much illness we see in our community. Wash your hands often with soap and water. If soap and water is unavailable, use hand sanitizer. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home if you are sick. Cover your cough or sneeze with your sleeve, elbow, or tissue and throw away immediately. Clean and disinfect. Frequently touch objects. And I also would add, cooperate fully with public health regarding any contact tracing, quarantine, or isolation efforts we do. Our goal is to be as transparent, as totally transparent, as we manage COVID-19. Today, we are also adding a COVID-19 data page to our website. As of today, it will show 1 negative test and 0 positive tests. Going forward, we will update that data page as often as we get information, as close to real time as we can. Now I'm going to ask our health officer, Dr. Hendricks, and he's going to talk to you about some actions we want certain high-risk groups to take now and where the public can go for more information. And then our epidemiologist, Beth Fulbright, is going to briefly explain steps we will be taking to lessen the spread of COVID-19 in our community if it reaches our community. Thank you. Dr. Hendricks?
Well, I think you're going to see a common theme through our comments here today. It's important to remember that most young and healthy people, the risk of serious illness from this virus remains low. However, there are things we can do which will further safeguard our community, especially for those who are at high risk. This includes citizens who are over 60 and also those who have chronic medical problems like heart and lung problems, kidney problems, diabetes, those sorts of things. It's the responsibility of all of us, and particularly the younger ones, the young healthy people around, and by young I mean obviously my age and younger, to take care of themselves and protect themselves in order to protect those who are at increased risk. We can do this by following measures to protect ourselves from catching the virus or spreading it if we do get sick. As previously stated, these include hand washing with hand sanitizer or soap and water, covering your mouth and nose if you sneeze or cough with the tissue like Becky said, or something you can dispose of. If you avoid touching public spaces, try and avoid touching your face too much, and if you do get sick, no matter what the cause is, stay home and isolate yourself from others. If you are one of those people at high risk, those people who are over 60, those people who have a chronic health problem, it's especially important to protect yourselves. The history of this virus has shown it tends to hit the older people and people with chronic health problems much more seriously. That's not to say that younger people can't get sick, and occasionally seriously so, but on a percentage basis, we're really seeing it most with the older folks and the sick and the people with chronic health problems. So if you are in that high-risk group, this is a good time to stay home, even if you're not sick. If you do have to go out, avoid crowds. Try to keep at least 6 feet between yourself and others. Try to avoid anyone who is sick. If you see someone over there coughing and sneezing, that's probably not the person you want to go over and get up close to. You need to continue to follow all those previously mentioned recommendations, and remember that soap and water works just as well as hand sanitizer if you can't find any, and we know that's been a problem. Aggressive measures now could prevent more disruption later. You should also be sure you're prepared if you do get sick, and this is preparation in advance. Don't wait. Make sure you have an adequate supply of food and medicine. 2 weeks supply is recommended at home. Stay in contact with your friends and family, especially if you live at home. Have someone who can care for you, or at least that you can contact or will check in on you periodically. If you do live with others, make sure there's a room kind of set aside that you can be your room, kind of your sick room to stay in, so you can avoid getting too close with family and friends. Have supplies on hand for being sick, like tissues and over-the-counter medicines for fever and aches and pains. Contact your physician or your practitioner for further advice, especially if you develop more severe symptoms like shortness of breath. Always call ahead if you're going to see your physician or going to any healthcare facility, so they can prepare and be ready for you when you come in to protect other patients too. I really want to emphasize that if you're sick and you need to go see your doctor, call ahead. If you're going to an urgent care, or if you feel like you're sick enough to go to the emergency room, call ahead and let them know. And if you're in an assisted or long-term care facility, check with the staff and make sure they followed all the CDC guidelines. It's very important to stay informed. There's a lot of information out there, especially in social media, and a lot of it's not very reliable. We urge you to seek authoritative and credible information. The health department's hotline is open, and it's available for questions and reference to resource information. The number is 209-8383. We have real live people answering the phone and answering your questions, so you don't have to worry about voicemail or, type 1 for cough, 2 for a sneeze. Also, the website, the CDC's website at cdc.gov is an excellent resource for information. So thank you for letting me say that, and now our epidemiology supervisor, Bev Fulbright, will fill you in on what she does.
I am Bev Fulbright in epidemiology at the health department. I wanted to just give you a brief overview of what our response in epidemiology is when we do get our first case. So the responsibility of the epi department, first of all, when a case is identified, is to interview that person and collect a list of all their recent contacts. Once we get that list, we'll contact each one of those people on the list and determine their risk factors. Once the risk factors have been determined, we will place them in quarantine, the high-risk people in quarantine for 14 days. They'll be required to take their temperature twice a day and monitor their health. We will call them every day to make sure that they remain symptom-free and are remaining in quarantine. We'll issue letters of quarantine to all of these people, and as I said, we'll be checking on them every day. If they were to develop symptoms, we will help them coordinate getting tested and getting into care safely.
Okay, I should have said on the front end, but it's amazing we got all three hospitals represented here today. We got CHI Memorial, Erlanger Hospital, as well as Park Ridge. So again, we're very grateful. These are people that that's taken time throughout this process, been in the same room with them gosh, it's been well over a week now in preparation for this, and today they're represented by Ray Vaughn, who's the Executive Director of the Health Services. So, Ray, you want to address them?
Thank you. Yeah, I'm the Executive Director of the Chattanooga-Hamilton County Medical Society, and I'm really pleased to be working with all of the area hospitals on the medical community response. Area health systems and the medical community continue to monitor all of the CDC updates on coronavirus, and we're working closely with the county and state officials to provide information in a timely manner to our patients and to our staff. Each of the health systems and medical practices have protocols in place, and they have trained team members in infection prevention and in emergency management to provide the necessary treatment for patients exposed to pathogens, including coronavirus. No matter the situation in our communities, medical personnel encourage residents to continue to communicate and see their provider for ongoing care until further information is provided to patients. Facilities and offices remain safe and open to care for patients. And that's a really important point, especially if you've got a chronic disease or chronic issue that you're dealing with that requires very timely medical care. If someone's experiencing a fever, cough, and respiratory symptoms, please contact your healthcare provider. Provide care for yourself and remain quarantined at home. until you're symptom-free to prevent further spread. And at this point, we're really in a posture of trying to prevent spread of the illness. If you're experiencing severe symptoms that are unmanageable at home, seek immediate care as soon as you can. If you're seeking emergency care or visiting a physician practice or urgent care facility because of your illness, please call them before you arrive to let them know about your symptoms and to receive further instructions. Some practices are setting up a remote location, a separate location to receive patients. They're all developing triage protocols to ensure the safety of both patients and medical staff. If you make that phone call, let them know your symptoms and wait for further instructions. That will just ensure that all precautionary measures are activated to help protect healthcare providers, patients, and you from contracting or spreading the virus. Be aware that some medical facilities have restricted entrances and visitation policies in place, and those are to protect the health and safety of patients and staff members. We ask that you please be patient and understand you may be asked to change your plans without notice. I think the core message is we're all in this together. We appreciate everyone's efforts in taking preventative measures to limit illness and for allowing protocols and official communications to take place. This is a great community. There's already been an incredible mobilization effort that's been taken, and I have absolute confidence in our capacity to work together, to move forward, and to protect the health and safety of our patients, our citizens, and all of those who work in the healthcare community. Thank you very much.
And now we'll hear from Dr. Edwards-Towns of the Hamilton County Department of Education.
Good afternoon. I'm Dr. Nakia Towns Edwards, and I'm the Chief of Staff for Hamilton County Schools. So this afternoon, in coordination with our Superintendent, Dr. Brian Johnson, and our School Board Chair, Chairman Joe Wingate, we began discussing plans for how we would respond to the rapidly changing conditions around the coronavirus. And I think it was Dr. Hendricks who said that we might take aggressive measures now to prevent greater disruption later. So with that stance, we have decided and we have announced that beginning on Monday, we will have students out of school from Monday, March 16th through Friday, March 20th. March 16th was already planned to be a student holiday. It will be a teacher work day, which we will continue with our teacher work day. As of today, we have canceled all of our after-school activities, field trips, athletics, and practices. Beginning on Monday, we will also cancel our after-school, school-age childcare. We are also proposing that on Monday, our school board consider a recommendation to adjust our calendar. We had originally planned to start our spring break week on Friday, April 3rd, and run through the following week, April 7th through the 10th. We are asking our school board to adjust the calendar so that our spring break would actually start on March the 23rd. So March the 23rd through the 27th. So what this would mean is that for the next 2 weeks, beginning on Monday, March 16th, that we would not have students attending school. So this is out of an abundance of caution that we believe it is prudent at this time to make sure that we consider the safety of course, our children and our families and our broader community, though we know that from some of the CDC and Department of Health communications that children under 19 have not been at the greatest risk for the most severe symptoms. They can be carriers of the virus and put others who are more at risk at peril with this particular virus. So that is where we are in terms of the public school district. Starting on Monday, students will be out of school from Monday, March 16th through the 20th, and then pending school board action on Monday the 16th, we would be moving forward with our spring break on Monday, March 23rd through Friday, March the 27th. I'll hand it back over to the mayor.
Thank you. Okay, before I open up for questions, I just want to say, once again, as you look at this group of people that are assembled here and the ones around the room, it has been, a coordinated effort from everybody having some input, and with a common goal. I mean, as Ray said, we're a united front. We want to minimize the impact to our communities, and that's what our goal is long term here. So With that, I'll open it up for any questions.
This is a health department question. When should someone who is concerned that they might have encountered it seek testing, and is testing available in Hamilton County?
Yeah, go ahead. Sorry, didn't see you back there.
I think in terms of seeking care, that's a judgment issue. Obviously, if someone's severely ill and shortness of breath has been one of the severe symptoms we've looked for in this, then they definitely should. Most people who get this, particularly the younger and healthier people, are going to have a respiratory illness and get better, and they probably do fine. They don't even necessarily need to see a doctor. They don't necessarily need to be tested. They can stay at home, isolate themselves, do all the precautions we talked about. If they do decide, and then it might be a good idea at that point to call their doctor, like we say, or to call our hotline and get some advice and see at what point they might need to actually be seen. But for the most part, the vast majority of people, it's a mild respiratory illness. In terms of testing, you can be tested in Hamilton County. The testing isn't done here, but the specimen can be obtained. Most doctors' offices and such have the facility to do that. More and more are developing the protocols for collecting the specimen, and then that is sent to a lab. We're mostly sending to the state lab, but now several commercial labs have become available in their testing. So I can't tell you any numbers right this minute, but the availability of testing is rapidly expanding, and as more and more commercial labs come online, that should continue to improve.
So the 1 negative and 0 positive, does that mean only one specimen from Hamilton County has been fully tested so far?
That would be one from the state lab. Commercial testing is available fairly widely now, so we anticipate the broader number of tests that will be coming in. And I would just say, to add to what Dr. Hendricks said, early on right now, if someone has a suspect that they believe they may have COVID-19, I would call your doctor. We would do testing now, certainly, because we don't have any virus in the community that we are aware of, and we would want to know if it's here. Once it is if it becomes widespread, I would say, if it becomes widespread, then testing everyone is not necessary.
Go ahead.
Yes.
So how long does it take once you guys send those tests to the state or to the CDC? How long does it take for them to process that to find out if it's positive or negative?
Typically 24 to 48 hours, but it can be longer than that depending on really how many tests the state lab receives that day. I don't know exactly how many they are capable of running every day, but they load that capacity at some point in the morning, and then takes them all day to process that and do their thing. So they only have a certain capacity every day.
Are you guys monitoring anyone else right now? I know you've only tested, how many people? Just one? Or how many?
The state lab has tested one for Hamilton County, yes.
And are you sending more? Have you monitored anyone else at this time?
There are more at the state lab, but we are not monitoring anyone. Travelers?
Yes.
Okay. Beth?
We are monitoring 2 people now that have traveled to Italy and come back. So their monitoring should be up this week, in fact, but we are watching them for symptoms, and they've remained symptom-free.
Are they part of the category of being more at risk, like you said, you mentioned 60 or older and more at risk, or what are they categorized?
No, their only risk category was traveling to Italy, so that's why we have them quarantined. But they have no symptoms.
How many doctors here in Hamilton County are developing that protocol to administer this test? And of those, are they at all 3 of our main hospitals?
I can't tell you how many practices. I don't know if any of the hospitals want to address that, but I'm sure physicians from all hospitals are testing at this point. The hospitals are setting up their protocols, but I couldn't tell you how many. That's individual. A lot of doctors are involved with larger groups, and they're developing their protocols. So many, but I can't give you numbers.
At least at this point, I don't believe any local hospitals are doing testing. It's big private laboratories like LabCorp.
So
But again, they can.
representative would come in to say Erlanger if they thought they were presenting those symptoms.
Well, again, they can collect the specimen, but send it to a lab.
Right.
Sarah, so if you go to your doctor's office, they might bring somebody from a commercial lab to come test, or do you have to separately go to another lab?
Okay, let me clear that. The test is it's very similar to a flu test. It's a nose and throat swab. So any doctor that does flu tests can do this test. So they obtain the specimen, and then they put it in the appropriate container, and then like a lab courier comes and picks it up, goes to the private lab, they do the test. That is kind of confusing because people talk about test kits. The test kit actually is at a lab that runs the test for the result. So it's a nose and throat swab that any physician can do that does flu test.
Go ahead.
I had a school question. I was curious if online classes was something that was talked about, if this goes longer for the schools, and if that's a capability that the schools.
So as of this point, our teaching and learning team, because the district has been working on contingency plans now for a couple of weeks, we have put together a learning packet for K-12 for every grade level that should cover about a week and a half of activities for students. So it's very self-directed. We are making copies and sending packets to schools this evening, and so we hope to have those ready to distribute as students leave on Friday. So for next week, we have those packets. We are posting electronic versions of them on our website at www.hcde.org, so parents are able to print those out as well. If we are not back in school as we anticipate, as we are planning for on March 30th, then we have more distance learning, online learning capabilities. We will use next week, the week of the 16th through the 20th, for our staff to continue to work on what those extended learning, distance learning opportunities will look like. So we already have platforms in place. We will ask that our teachers continue to work on those plans so that if we are not back in school as we anticipate on March 30th, we do have some additional opportunities.
Related to school as well, for the teachers during this cancellation, will they be paid during this time, or will this affect them pay-wise or no?
No, salaried teachers are salaried employees. Spring break is already built into their pay, into their regular pay contract. We are asking the school board on Monday to consider contingencies for our hourly staff, for classified staff. It is our hope and intention that they will approve allowing us to pay those staff. So if you're a school-based, let's say a lunch lady or an educational assistant, you would not be in school next week, which was unanticipated, but we are going to try to provide that pay because this is beyond their control.
And another thing with school, with the cancellation, could this affect seniors graduating coming May or no?
We don't anticipate that. At this point, the 4 days, it's only 4 additional days that we anticipate that students will miss school. We actually have 5 remaining stockpile days that are built into our calendar, inclement weather days. So right now, if we move our spring break, if the school board approves that on Monday, we would then just have our regular 5 days that we had anticipated for spring break. It will be 4 additional missed instructional days, but again, we have 5 stockpile days, so that wouldn't impact our calendar at all.
Let's just do one more question.
Sarah's got her hand up.
Is the county doing anything specific for more vulnerable members of the population, like the homeless or people without insurance?
Yes, we run the homeless clinic, and as the supervisor of that clinic, Karen Gwynn, has been appointed as the point person to work with the homeless community, because certainly there's the kitchen, there's homeless shelters, and all of those entities and the homeless citizens that attend those are at higher risk just because of their living conditions, health conditions, and all. So we've been working really diligently with those, all of the homeless providers in our community. Sure.
Also, I know they're meeting tomorrow. There's a meeting tomorrow with the homeless staff, and Dr. Karen Moyer is going to be talking to many of the agencies that work with the homeless shelters and such about provision. So they're working together on that.
We know you've got a lot of time at 5, so we thank you all for coming.
Well, I'll close with this. Know this, we are 100% committed to keeping the public informed. I think it's really critical during these times that we do so. And in our commitment, as you can see from all of us, is the minute that we have any additional information, updates, or whatever, we'll certainly call your attention to it, because we do think one of the things that's going to help us through this crisis the most will be the fact that we keep people informed and they make good decisions on their own. as well as from the information they've been able to gather today. So again, thank you for being here, and we'll see you later. Thank you.